why no one else can hear me. But let me see if I send a text if they can respond at least by. If you all can do me a favor, if you can hear me, turn your cameras on and give me a thumbs up if you can hear me. Okay, perfect. I got a thumbs up there. Okay, that's 2. All right, Dr. Joseph, can you hear me? No thumbs up there. Oh, okay. Is that a thumbs up? I think that's a thumbs up. Okay. And Dr. Olga, can you hear me? All right. Well, we're recording this anyway. So just in case someone cannot hear me. Okay. So Dr. Olga, all right, got you. Thumbs up. Perfect. So just in case someone cannot hear me, you can always go back and look at the recording. Okay. The other thing I wanted to touch bases with you all on too is to make sure, like in the calendar. So was it pretty easy to navigate with the calendar?
Yes.
Okay. All right. Perfect. And the beauty of having a microphone and being able to talk with me is so you can ask questions during the class and I can hear you. If I can't hear you, it's going to be kind of hard for me to answer your questions because I can't hear you. So, and like Dr. Pina, I heard you earlier today. So I'm not sure why I can't hear you right now, but I did hear you earlier. But it shows that your microphone is muted, but I'm not sure. Yeah. Yeah, we'll work it out. We'll work it out. We'll get through it. Okay. So tonight, basically what I want to do is I want to kind of talk to you about number one, studying. And then did you all have a chance to kind of start to look at the antibiotics? Okay. All right, perfect. Okay, so I'm going to share my screen with you. And then as I go through these things in the screen, it's basically we're going to be talking about first of all, how to study. Okay, that's going to be the key thing. And then we'll go into the actual start looking at the antibiotics. Okay. All right, make sure everybody can see my screen. Okay. Let's see here. All right. Now, because I cannot, obviously, I won't. Now, when I'm sharing my screen, I actually can't see you. So I will need someone, I guess, Dr. Paula, sir, if you can let me know. Can you see my screen?
Yes. Mm-hmm.
Okay, perfect. All right. All right, good deal. Okay, so basically, in terms of studying, okay. So whenever you're studying, I know you all have gone through dental school. You're a dentist. You're well established. But for the IMEDE, I want to kind of tell you how we want you to kind of approach the studying. Okay, so we want you to study as if you are a detective. Okay, the whole purpose in anything you do is you're going to be a detective in terms of how to find the answers that you're looking for. So, for instance, tonight we're doing antibiotics. So, Dr. Paula, sir, when you started to look at the antibiotics, how did you approach the study? How did you approach that lecture?
Um, just to wanted to start easy, I was trying to look for the one that I knew. So,
Okay. Okay.
uh, and then I started. Um, mm,
Just kind of you kind of
Maybe,
started reading, right?
yeah, just by reading and a
Right.
big picture first.
To get big
Yeah.
picture. Good. Okay,
Hmm.
perfect. Okay, so let me tell you how I want you all to do it. So, for instance, tonight we're covering antibiotics. We're going to be looking at some antibiotics. So, the first thing I want you to do before you do anything is ask questions of yourself. For instance, you want to know, okay, which, I'm going to just put AB for antibiotics, right? Which antibiotics are we discussing? Okay, that's a question you want to know. You want to know also, how does the antibiotic work? Okay, are there any contraindications for the antibiotic? Um, so so you want to look at different things. You want to ask yourself these questions first. Why do I want you to ask the questions first before you even start to read? What do you think is the reason?
Uh,
Uh-huh.
I think because it's these questions are the baseline of all different types of antibiotics and how they actually interact with different microorganisms.
Perfect. Now, I love that. Now, guess what? Also, if you are looking for contraindications for an antibiotic, and as you're reading, you see something that says this is a contraindication for, let's say, amoxicillin. Soon as you read that, your brain gets excited because you're like, wow, that's what I'm looking for. Anytime that your brain gets excited, we call that emotional retention. So the reason that 90% of the dentists in our program pass the exam is because we teach them this right here. This is crucial. Have you ever read something and you read it like two or three, read it once and had to read it again and maybe even read it a third time? Have you ever had to do that just to make it stick? Well, if that happens, that means that you're not retaining the information. The way that we retain information is based on a feeling. How do you feel about it? It's emotional. If you're excited about something you read, you tend to remember it. If something frustrated you or you got mad at something you read, you tend to remember it. So the reason we want you to ask questions first is because now, whenever you look and you start reading and you see something that you were looking for, your brain will get excited and you will retain the information better. Does that make sense?
Yes, doctor.
Okay. All right, perfect. So the first thing is never, ever, ever start reading without having asked questions first. Even if you don't know what we're going to be talking about, at least ask you some general questions, okay? So that's the first thing with emotional retention. Now, the next thing I want to tell you about is this. So, after every topic, you're going to have a quiz in your class marker, right? Everybody's going to have a quiz in the class marker. And whenever you do that quiz, whenever you miss a question, this is going to be crucial. You're going to need to keep a little notebook to let me know your content areas. But you're going to put a C, A, S, or a T next to the question on why you missed the question, okay? So the C means you missed the question because of content. You just didn't understand it, or you didn't remember it, or didn't understand, okay? So that's the C. The A means you missed the question because of application. Application means you know the content, you understand the content, but you didn't know what the question was asking. Okay, does everybody understand that? Everybody follow me?
Yes, doctor.
Okay, perfect. Okay. The S means you missed it by a simple mistake. Okay, you were moving too fast. You were moving too fast and you just made a simple mistake. Okay, and the last one is T. You did it because you ran out of time. Now, typically, if most of the questions you miss are related to C, the only way you correct that is with more studying. You have to study more. Okay. Now, if you missed a lot of questions because of application A, that means that you're going to have to probably get myself or one of the other instructors to maybe do a few questions with you to see what kind of mistakes you're making. S, simple mistake means you just need to slow down. All right. And then the T, if you're missing question because of time, the way you correct that is with more content. Okay. Any questions on that? We call that the CAS method. Any questions on that? Yes, no?
No, doctor.
Okay, perfect. Because I think I only have 2 people that I can hear on the computer, and I can't see anybody. Okay, all right, perfect. So that's the approach that we're going to be using. Now, the other thing is we're going to be using a lot of what we call mnemonics, okay? A lot of mnemonics. Let me go ahead and pull this up for you. Now, did everyone get a chance to complete the clinical evaluation?
No, doctor.
Right. Yeah, I know you and I have already talked about that. What about everyone else? Dr. Policer, did you complete it?
Yes, doctor. Yeah, I was
Okay.
able to finish it.
All right, perfect. Was it pretty easy?
Not really.
Okay.
The
That's okay.
first 100 questions was like it was a little easy. There are clinical questions, I guess.
Right.
And after that, I felt like my body became tired, and then
Yeah.
I was losing attention. I was doing in the middle of the night, so everything together
I got you.
made me felt a little difficult, but not my
Okay.
best. But I tried.
That's all right. It'll get better.
Yeah.
It's gonna get better. All right. So let me go ahead and pull this up, and let me just tell you the way we do the way the class runs is that at any point, if I say something that you don't understand, stop me. Okay. Just, you can ask a question at any point, anytime, and you can always interrupt. Okay. Everybody follow me there? Okay. All right. So let me go ahead from the current slide. Okay. So first of all, tell me, what is the difference between a aerobic and anaerobic? What's the difference between those two?
Aerobic needs oxygen to survive, and anaerobic doesn't need oxygen to survive.
Perfect. Now, do you think they're going to ask you that on the exam?
I wish they do.
They do not.
No.
That's too straightforward, right?
Yeah.
They're not going to ask you anything about whether this is aerobic or anaerobic. Now, what they will ask you, though, is they may ask you, okay, most of the bacteria in the mouth, they may want you to know, okay, what is one of the characteristics? Is it aerobic or anaerobic, right? Most of the bacteria. But they'll put that more in all of the following except is true about oral flora, okay? And so they're not going to ask aerobic or anaerobic directly, but just know basically. So let me just ask you, if I asked you about the mouth, what is the mouth? Is it mainly aerobic or anaerobic?
Aerobic.
Okay. Everybody agree with that?
I feel it's anaerobic.
Okay, you feel it's anaerobic. Okay. So we do know that the mouth is it has a mixed flora, right? We do know that. We know that the mouth is both aerobic and anaerobic, right? But typically anaerobic is higher in quantity. Typically, okay, for the most part. All right, got that?
Okay.
All right. Now, next question. You remember I told you all one of the key things that you need to know for the test is patient management. I cannot express that enough. So let me ask you, a patient comes in, and when would you say that a patient needs a culture? When would you have to culture a patient? Well, let me ask a different question. If a patient comes in for a root canal, would you do a culture on a patient who came in for a root canal?
No.
No, doctor.
Okay, good. I agree. So there are certain instances, right, that you said, oh, I got to get a culture. So when would be an example of you saying, I need to get a culture?
When a patient comes in with a matured infection or severe infection.
Now, how do you define
recurring abscess.
Oh, okay, a recurring
Or
abscess. Okay. So how do you know something is serious? What is your determining factor of something being serious? Okay.
even after sorry, go ahead.
Accumulation and changing of the surface of the tongue. Usually we see a lot of different discolorations, sometimes greenish, sometimes yellowish, and the viscosity of the saliva.
So you said something that was very key there. You mentioned changes and you said surface changes, right? So kind of going back to what we were talking about with serious. So let's look at some of these things, right? And I just want to point these out. And the way that they're going to ask you this question on the INBDE is they're going to give you a patient and they're going to give you some type of clinical history. I mean, some kind of past medical history and a clinical history, current findings. And they're going to want to know if you should culture or not. Okay, that's the question. And so one was serious infections, life-threatening infections, right? And one of the questions I was asking Dr. Polisser is, how do we know something is serious, right? So obvious changes and changes that are progressively getting worse. Because I think that's kind of what you were alluding to when you were talking about, would you say kind of recurrent infections? Is that what you said?
Mm-hmm.
Right. So recurrent infections that are getting worse. So typically a worsening infection in the presence of an antibiotic could be a reason to culture. Does that make sense?
Yes.
Okay. And this kind of goes along with the previous antibiotics or multiple antibiotic treatments. Now, immunocompromised, right? Give me an example of an immunocompromised patient.
Patient who is under chemotherapy.
Okay, that's one. Give me another.
Diabetic patient.
Yep. Okay. So chemo. Okay. Diabetic. Give me another. You're doing good. What's a big one that it's not as big anymore, but still pretty big, but HIV. Good. Perfect. What about can an elderly person be immunocompromised?
Mm-hmm.
Yeah, right. Yeah, like like somebody who's really, really. I mean, when I say elderly, I'm not talking about somebody in their 50s or 60s, right? Now, when I say elderly, sometimes my grandkids would say that I'm elderly, but we know that's not true. So we're talking about somebody like elderly, like 80s, right? Could be immunocompromised. So any of these things right here. Now, immunocompromised patient. Why would you feel like you need to culture an immunocompromised patient?
Because even after treatment, their prognosis, their healing might be slow.
Exactly. Very good. Very good. Now, look at this one right here. Osteomyelitis. Can someone tell me what drug could contribute to osteomyelitis? And this is a test question from the IMBE. What drug can contribute to osteomyelitis, causing osteomyelitis? Starts with the letter B. Have you all heard of bisphosphonates? Yes. Okay. So like alendronate, zendronate, right? These bisphosphonates can cause it can actually cause an osteomyelitis, also like an osteonecrosis of the jaw. Everybody follow me?
Yes.
Yes, doctor.
Now, actinomyces, is this life-threatening? The answer is yes, right?
Yes, doctor.
Now, that's right. Now, have you ever heard this is the answer. I'm giving you the answer for the IMBDE. Actinomyces. Your answer is sulfur granules. I can already tell you, if you see actinomycosis on your test and they have an answer choice, the answer is going to be sulfur granules because they're more than likely going to ask you for a description. Okay, everybody follow me?
Yes.
Yes.
All right, so far so good. Okay, now this right here, the only thing I want you to show you with this is strep, right? So strep, let me ask you a couple questions. Let me put strep right here. Is strep gram positive or gram negative? It's gram positive, okay? Everybody follow me so far? So strep is a gram positive organism. Gram positive, if you see this plus, right? Gram positive will stain purple. Hear me so far, okay? Gram positives have a thick peptidoglycan wall.
Glycan.
Now this is gonna be, yeah, y'all follow me? Y'all follow me so far?
Yes,
Yes.
doctor.
Okay. This thick wall is going to be the way that the antibiotic is going to target that specific organism. Okay. So strep, they're gram positive. They have a thick peptidoglycan wall, right? And watch this. This is going to be, right? So what is H2O2? Does anybody know what is that? This is called peroxide. Hydrogen peroxide.
Hydrogen peroxide.
Okay. Correct. The strep species, these are basically, we call them catalase negative. Catalase negative. What that means is that because they're catalase negative, they don't break down hydrogen peroxide. Okay, got it? Now you may ask the question, why is that important? What's the big deal, right?
Sorry, doctor.
yes.
Would you mind
Repeat that? Okay.
for me? Go ahead.
Absolutely. So the strep species are catalase, it's an enzyme, right? And for instance, Staphylococcus species like Staph aureus, Staph epidermidis, the Staph species, they are catalase positive. They have that enzyme. Because they have that enzyme, they're able to break down hydrogen peroxide. Okay, does that make sense so far?
Yeah.
Now, strep, on the other hand, is catalase negative. That means that it's not able to break down the hydrogen peroxide. Does that make sense? Are you with me?
Yes.
Okay.
Doctor, so basically, the strep, it's sensitive to hydrogen peroxide.
Correct. Exactly. So it can't. So if you put staph in the presence of hydrogen peroxide, you'd see it bubbling up. Okay.
Understood.
Now, so strep viridans is the big species of strep. Under strep viridans, you'll see some streps that are normally in the test: strep mutans, strep sanguinis, strep aureus. These are the three most common ones you see on your exam. Okay. If you see these, just know that they're all part of the strep viridans family. Okay. Now,
Okay.
you probably remember strep mutans from what? What is strep mutans known for? Causing what?
Carriers.
Do you remember?
Endocarditis.
Dental caries, right? That's right. So strep mutans, and the way that strep mutans does that, it has an enzyme, right? And this enzyme has the ability to break down sucrase. Okay, it can break down. So this enzyme basically breaks down sucrase or sucrose, and by break down sucrose, you produce something called glucose and fructose. All right. Now, fructose will give us something called levains, and glucose gives us something called dextrans. Does that make sense so far?
Yes, doctor.
And so these dextrans, we know that if you start to accumulate these dextrans, it can lead to the formation of what?
Dental caries.
Caries.
There you go. Good. Perfect. Now, let me just tell you, the reason that you'll see pausing sometimes is because I love the class to be interactive. I don't want to be just talking. I want to make sure, we're interacting, okay? So these are some of the things that you're going to see, but those are all strep species, okay? This part I'm going to skip because that's not high yield for the test. So I'm going to go to the next part that is high yield. Okay. Okay, here we go. Not this part. I will go to the part. Okay, so, and you're going to go through some of this also when you get into the periodontics. So they're going to go through that, okay? So let's talk about the antibiotics themselves, okay? When do you prescribe an antibiotic? What would be the purpose? Like, when do you prescribe an antibiotic?
If there is any
Patient
type of
come in with-
infection. Sorry, go ahead.
Yeah, I was about to give the same answer. So, yeah.
Yeah.
What were you going to, what'd y'all say?
Infection.
Okay, infection. Okay, gotcha. And what if you don't know the cause of the infection? What if you don't know if it's viral or fungal or bacterial? Do you still give an antibiotic?
If it's fungal, we don't actually give antibiotics. In that case, we have to make a culture. But if it's any type of a bacterial infection, then, and we don't know, and we can't specify the type, we actually give a wide spectrum of antibiotic.
Okay, I got you. So if somebody had an abscess, is that bacterial, viral, or fungal?
It's localized bacterial.
Okay, so in that case, an antibiotic would be prescribed, correct?
Yes.
Mm-hmm.
Yes.
What if somebody had this white film on their tongue that you can scrape off?
That's a fungal.
Fungal.
Which fungus? You're right. You all are right.
Candidose.
Candida. Very
Yes.
good. Also known as thrush. Very good. Perfect. Very good. Exactly. I love it. What if somebody had on the inner, here on the inner mouth, they had a fluid-filled vesicle?
Mucocil.
What is it? Is it bacterial,
Mucocil.
viral, or fungal?
Viral.
You think viral. So what are you thinking? What type of virus?
Lincoln planus.
That would be
autoimmune.
That
would be more of an autoimmune.
Yeah, that's not so most times if you see something, if they mention the word fluid-filled vesicle, you're looking for herpes. So you can have herpes like on the on the lips, but also on the inner part of the mouth as well. but they're specifically going to say fluid filled vessel. Okay, everybody got that? Now, what's the difference between bacterial and bacteriostatic? Well, what's the word cytal? If it ends in cytal, what is
bacteria.
It kills the bacteria.
I heard
It
somebody say,
kills the
what is
bacteria.
it?
It kills the bacteria.
I heard kills.
Yes.
And what does static mean?
It stops.
Yeah, suppresses the growth.
Okay, very good. It stops. It stops, but that right. So it'll actually stop the further growth of the bacteria. Okay, does that make sense? Everybody understand that?
Mhm.
Now, I'm going to say something right now. Please hear me closely, because if you hear me closely, this will answer at least 3 questions on the IMBDE regarding antibiotics. Okay. Number 1, if a patient was previously allergic to a bacteria, do you think they're still allergic?
Yes, doctor.
Yes.
Good. That's yeah, right. It seems like some concept, right? But let me tell you what they'll do on the exam. They may try to change it up a little bit, and they may even tell you, they may put something in the patient history and said, on a previous visit, the patient was given, say, amoxicillin, and they may say something real simple like, patient noted some bronchoconstriction, right? But something simple. They'll make you almost think it wasn't a big deal. And then they'll ask you a question about, now they're coming in for some type of major bacterial infection, and which is the best antibiotic. So in that case, what do you not give them? So they came in previously, you gave them amoxicillin, and they reported that they were having some bronchoconstriction, and you could tell there was some type of reaction to it. Now they're coming back in for a bacterial infection. What do you not give them? What is contraindicated?
Penicillin.
Yes, perfect. Penicillin. Does everybody understand that?
Yes, doctor.
Okay, perfect. Now, that's the first thing. The second thing is more is better. Now, I try to keep this real simple. I know it sounds super simple, but this is what I'm saying. So you got somebody on amoxicillin, right? And the bacterial infection is not really going away. Do you add more amoxicillin?
No.
No. Why not?
No.
It's not affecting the bacterias.
Okay. Do you discontinue the amoxicillin?
I would change the type of antibiotic.
Okay. So that is an option, to change the antibiotic itself. Could you add another antibiotic to the amoxicillin?
It's possible.
Mhm.
Would you though? Would you add another? So okay.
I'm not quite sure, honestly.
Okay. So think of it this way. If you're giving them amoxicillin and amoxicillin is not working, right? If you're giving them amoxicillin and it's not working, what would be the benefit of keeping amoxicillin and adding another antibiotic? Would there be a benefit to that?
No, none.
Okay. So for the most part, more is not better. So I agree with you. I would definitely look at a different type of coverage. So at that point, you remember we talked about, when do you culture?
Yes, doctor.
So at that point, guess what we need to do? We need to do what?
A culture.
We need a culture. So we need to find out exactly what type of bacteria we're dealing with. Does that make sense to everyone?
Yes.
Okay. So far, so good. This is pretty easy, right? Okay. All right. So the next thing I want to do is we're going to just do this question. All right. All right. You probably have already seen this, but can someone, let's see, read the question and tell me how to approach this question?
Patient is a 35-year-old white Caucasian male, 5 feet 9, and weighs 160 pounds. Chief complaint, I feel a little bump on my gums. Background and/or patient history, no history of STD or HIV, no known allergies. Current findings and the image.
Okay. So what's next? What do you do next?
So, based on my experience, I would actually, the question is asking about antibiotic. If it
Okay.
was a clinical case, I would try to use a gutta-percha to find the cause of the infection and do, if it's an odontogenic infection, I would do a root canal treatment.
Mhm. Okay.
As for the antibiotic, amoxicillin 500 milligrams.
Okay. All right. Does everybody agree with that? Amoxicillin, 500 milligrams?
Yes.
Okay. Now, let me just tell you something. I love the way you did it, but let me just tell you, for the INBDE, you've got to totally abandon that approach. All right. Now, what I want you to do going forward, whenever you have a question box, I want you to read the question first. Okay. So read the question first. Why do I want you to read the question first?
Because it says what's the best initial antibiotic for the patient.
Good. The reason that I want you to read the question first is because on the INBDE, you're going to find out that almost 50% of the test, you don't even need to look at the patient box. Did you hear that? The questions themselves won't even, some of them won't even be related to the patient box. They'll be just questions that stand alone. So in this case, what is the best initial antibiotic for this patient? So they're showing you this right here, right? And so at this point, if you see this, are you thinking bacterial, viral, or fungal?
Bacterial.
Good. So at that point, if you're going to treat it and an antibiotic, then you're going to say, okay, what antibiotic am I going to be using, right? So your first choice was amoxicillin, okay? Why not ampicillin?
Honestly, I've used it more.
Okay. But there's a reason that ampicillin is wrong. Anybody know why this is wrong?
The dosage?
Well, the dosage is wrong. That number one, that's wrong. All right. And then typically amoxicillin is given by mouth, right? Ampicillin, you can give ampicillin how? How can ampicillin be given?
Intramuscular.
Right. And if you look at this patient, do you think that this patient they're talking about the best initial antibiotic, ampicillin would be the first choice?
Yeah.
Right. Now, clindamycin, right? Clindamycin, is that an antibiotic?
No.
Yes, it is. Exactly. And what type of antibiotic is clindamycin? is what we call a mac. Have you all heard of that, macrolide?
Yes.
And guess what erythromycin is? It's a macrolide. So guess what? One of the key rules for multiple choice tests, if you have two drugs that are in the same category, if it's not a detailed question, you can eliminate both of those answer choices. Do you understand that?
Yeah.
Yes, doctor.
Okay, perfect. That is the rule, not only for pharmacology, but for any section on the exam. If you have two things that are either doing the same thing or in the same category, if it's not a detailed, specific detail question, you eliminate both those choices. Okay. All right. Can someone else answer this next question? Tell me how you approach it.
What is
right,
what is the mechanism of action for the antibiotic used for this patient?
Good. Do you need the patient box for this?
No.
No, because we already know the antibiotic, right?
Mhm.
All right. So the question is, the second thing is, oh man, I should have told you all this. So this is key, and I should tell you this now. Let me interrupt this just for a second because this is key. One of the things that you're going to find very helpful is how to approach multiple choice questions. Okay. Let's see. How to approach multiple choice questions. Believe it or not, there is a mechanism to approach multiple choice questions. I don't care what question, how easy it is, how hard it is. I want you to use the same approach each and every time. Does everybody follow me?
Yeah.
Yes, doctor.
Okay. Okay. So I'm going to show you this approach. And each time, even if we're doing an easy question, I want to make sure you're doing the same thing. The reason that you're going to use this same approach each and every time is because once you get to the actual exam, you won't have any stress. You won't feel nervous because you have a plan and you'll be able to use that plan the exact same way. Okay?
Okay.
All right. Everybody got that? All right. So let me pull this up. And while this is coming up, any questions so far? Everybody good so far?
Yeah.
All right,
Yes.
perfect. All right. All right. So whenever you're doing a multiple choice test, right? The very first thing, let me go ahead and put this, we can skip that, is this. All right, what does this top box say?
Look for the actual question and
Look for
skip all the
questions.
fluff.
So look for the actual. There you go, right. So if you were to approach this question, what would you do first?
I usually read the last line and then go back and start
Okay.
from the
What does the
first.
last line say?
Which structure would help to clear mucus from the airway?
Perfect. Now, question. If you go back and you read this, you think that's going to help you? Do you think anything in this part is going to help you?
No.
Correct. So guess what? You would have wasted almost a minute reading all of that to answer a question you didn't even need that part for. Does that make sense?
Yes, doctor.
Yeah.
So that's the first step. So always read, skip the fluff, and get straight to the question. So when they say, okay, which structure would help to clear mucus from the airway? Well, then at this point, all you're saying is, okay, do I know the answer You know, is it cilia, dust cells, good cells, right? Do I know that answer? Now, this is just teaching you how to approach the questions. I don't care if you know the answer or not for this, but this is just teaching you. Okay. Now, let's look at the second thing. The second thing says what?
Read the question and put in your own words.
Yes. Now, let me tell you, if I had to, because we've been working with internationally trained dentists for, I guess almost 15 years now. And I will say that every dentist who has been trained internationally are super smart. But guess what? When English is not your first language, you may know the information, but not know how to put it, right? Guess what? The first step in a multiple choice test is you got to be able to put the question in your own words. So if you read this question says what?
The peptidoglycan is which of the following will be most affected when placed in a hypertonic solution?
Very good. Right. So which would be exactly. Now, that's the question, right? That's the actual question. But I want you to see something right quick. Let's see. Let me see if I can go back. Let's see. Okay. All right. So I want you to see something. Now, you see what I eliminated? You see that part I eliminated, right?
Yes.
Okay. Watch this. I'm eliminating a lot of stuff, isn't it? You see all that stuff I'm eliminating? Wow. That's a lot of information, right?
Mm.
Now look at what this says now. The cell wall protects against osmotic pressure. Then they say which of the following would be affected when placed in a hypertonic solution. Now, does that sound easier than saying the peptidoglycan is the component of the cell wall? One function is that it protects against. So part of what I want you all to do is to eliminate words that are not necessary for the question. Does that make sense?
Yes, doctor.
Yeah.
Perfect. If you get this down, this is one of the key things that'll help you on the exam, okay? All right, perfect. Now, the next thing is once you put the question in your own words, then you got to do what? You got to think of an answer in your own words. Before you look at the answer choices, try to say, do I know what this answer is? If you know what the answer is, then what you're going to do next is you're going to look down at the answer and look for the one that you thought it was. Okay. Does that make sense?
Mm-hmm.
Okay. Now, the other part of the multiple choice test, if you look at say for instance, you look at the answer choices, right? And you don't really know what the question is. You don't know the answer, but you know the answer choices. And you notice that 3 of the answer choices are gram positive and 1 is gram negative. And let's just say you have no idea what the question is asking. What is your answer?
Klebsiella.
Exactly. It is. Why is that the answer?
Because all the other bacteria are gram positive.
That's right. And you remember what I told you earlier? If you have things that are the same, and then you have something that's different, you're going to eliminate the things that are the same. Does that make sense?
Yeah.
Yes, doctor.
Good. I'm telling you, if you all get this, I want to say you won't really need me, but you still need me for a few other things. But if you get this part down right here, how to take this test, you're going to, because I know you can study, but how to take the test is the important part. Okay. Now, here's what we just talked about. You look for answers that are basically saying the same thing, right? And then you eliminate everything that's saying the same thing, unless there's an option that asks for more than one right answer. So some questions on the exam may have 2 answer choices. In that case, you might be able to find 2 that are the same in answer. Okay. All right. So we skip that. And so we already know what the answer is. Now, this is key. What does this one say?
If you don't see your answer, then begin eliminating the answers you know the most about.
Did you say the one you know the least about?
The most about.
Did you say least or most?
Most.
I know you did. You said most, didn't you? Now, let me tell you why I emphasize most. Do you know I've worked with other like dentists when they're taking their, practice test, and we'll go through some questions. And as we're going through the questions, they may see an answer that they have never heard of before, right? Do you know they will eliminate their answer choice because they've never heard of it before? So you never eliminate something you've never heard of, because how can you say it's wrong, right? Does that make sense?
Yeah.
Now, I know you all have never done that, right? You've never eliminated something you've never heard of, right? So, key. So look at this now. Look at A. What does A say?
I'm 100%. Yes, go ahead. Sorry.
Go ahead.
Sorry, Dr.
Yeah.
Linda. Please go ahead.
Yeah. I'm 100% sure it's not the answer.
So what do you do with that? Do you keep it or eliminate it?
Keep it.
Wait. You're 100% sure it's not the answer.
Oh, yeah, I'm sorry. Yeah, we eliminated. Sorry about that.
Right. You don't want that.
So we know.
Right?
Yeah.
Okay.
We know the most about that answer. Okay.
That's right. Exactly. What about B?
We keep
What do
it.
you do with B? Do you keep it? You say you keep it. Very good. I like that. All right. What about C?
We keep it because we're not
No.
sure about it.
You would eliminate. Yeah, you would eliminate that one. And the reason why is because you're 40% sure it's not the answer. So when you're 40% sure it's not the answer, then more than likely you have a reason for why you think it's not the answer. You understand that?
Okay.
I mean, you're not like 100% confident, but there's something that you know about it that makes you think it's not the answer. Okay. So now you come down to D. I'm 20% sure it's not the answer. Well, you're not going to eliminate that right away, but now you're between two answer choices, right? B and D. Now, whenever you're between two answer choices, it's no longer a multiple choice test. Did you all hear me? It's a true or false test. You follow me?
Okay.
All right. Okay. Let me explain what I mean by that. Because you only have two choices, it now comes down to a true or false. What you're going to do at this point is you're going to look at the answer that you know the most about. Of the two, which one do you know the most about, B or D?
Well, I've never heard of this answer before. It's true.
Well, no. Okay, so let me make sure I said the question right. So the two choices you have to choose from are B and D, correct? Okay.
Yes.
If you were looking at those two choices, which of those two choices do you know the most about?
20%.
Good, perfect, exactly. So what you're going to do at this point is you're going to look at that question, that answer, and you're going to say to yourself, is this answer true for this question? And if you come to the point and you say, I don't think it's true, then you have to pick B, even if you've never heard of B. Does that make sense?
Okay. Yeah.
And if you get to D and you say, well, I believe it's true, and I really feel like it's true because I've seen it somewhere, I kind of think this is true, then you have to pick D. So a lot of times when you get down to these two answer choices remaining, don't think of them as multiple choice. Think of them as true or false. You pick one, answer that you know the most about and ask yourself, is the answer true? Does that make sense?
Yes, doc.
Okay, perfect. Now, watch this. This, hopefully, this will never ever happen to you on your exam. I'm hoping you never have to get to this one. But if you have no idea, then you pick B. If B is not available, you pick C. And if C is not available, you pick D. All right. Now, there is no magic to this. And that doesn't guarantee you're going to get the question right. But this is one of those ones where you have no idea what the question is asking and you don't even recognize the answers. Do you follow me? Okay. So now what we've done is we've gone through how to approach questions. Every single question should be approached the same way. All right? All right. Pretty easy, right?
Yes.
All right. I love to hear that. Okay. So I can eliminate this. We don't need this.
Doctor, I have a question.
Yes.
I've run with a couple of time questions which they have answers and all the answers are actually correct.
So,
But basically,
so you're saying that there are multiple correct answers
yes,
as the answer choice, meaning that they're asking you to choose all the answers that are correct?
without the answer of all the above, but all the answers
Right.
were correct.
Wait. Huh. So,
And
wait a minute.
basically, I came up with the idea that I have to choose which one was the most correct between all of them.
Oh, yes. So you are correct there. The IMBDE will ask you for the best answer. Okay. So, but we're going to be teaching you that throughout the course because you'll see that there are going to be some answers that are correct. Both are correct, but one is more correct.
Understood.
Yeah. Very good. I'm glad you brought that up. All right. Okay. This is the question. All right. So how do we approach this question? What's the step one? Anyone? Step one?
What is the mechanism of action for the antibiotic used for this patient?
Okay. Good. So we all understand what that means, right? But if I wanted, just say I wanted to put it in my own words, what I would say, because I already know what the antibiotic that we're talking about amoxicillin, right?
Yes, sir.
If I put this in my own words, I would say, how does amoxicillin work? Do you understand how I put those in my own words?
Yeah.
Yes.
So when I put them in my own words, it makes it easier for me to understand the answer choices. Now, I could say, what's the mechanism of action of the antibiotic used for this patient, and then say the antibiotic we're talking about is amoxicillin, but that's, too confusing. How does amoxicillin work? Okay, so what's the next step? I put it in my own words.
And you look for the answer that most fits your and
That what you're thinking about.
it
So you
fits
think of,
you. Yeah.
that's right. So you think of the answer in your own words. Now, so do you all know the answer right away?
I'm not quite actually sure about the mechanism of action of amoxicillin.
Okay, amoxicillin. Okay. So what is amoxicillin? What type of
Penicillin group.
antibiotic is it?
Penicillin.
Correct. So really this question is asking not about amoxicillin. This question is really asking about what?
Penicillin.
How? So it's really asking, how does penicillin work? All right. Now, does anyone know how penicillin works?
Blocks the 30s ribosomal subunits.
Well, so the 30S ribosomal subunits, those would be things like
Tetracycline, I'm sorry.
aminoglycosides. Correct. Aminoglycosides, tetracycline. Correct. So it wouldn't be that one. And then the 50S is the one I told you about earlier. That'll be like your clindamycin, erythromycin, lincomycin. All right. So those mycins, right? All right. So now, just say we eliminated those two answer choices and we're between A and C. Which of these two do you know the most about, A or C?
C.
Which one? Okay,
C.
C. So what do? You remember it's a true or false question now, right? So what you do is you ask yourself, because you're asking, how does penicillin work? And then you say, does penicillin block peptidoglycan cell wall? And you say, is that true or false?
True.
True. Good. So if it's true, then you have to pick it, right? So that is the correct answer. The correct answer is it blocked the peptidoglycan cell wall. Okay. Now, let's look at this question. What does this question say?
Which of the following is strictly contraindicated for the antibiotic used in this patient?
Okay. What is this in your own words? Come on. I know you got it. What is contraindicated for a patient?
Amoxicillin.
What do they take? Amoxicillin, right?
Amoxicillin.
Which is a what? A penicillin.
Penicillin.
So think about this question. So this question is basically saying, what is contraindicated? So if a patient is taking amoxicillin, what is contraindicated? What would be? So the way you would say this is, why would I not give this patient amoxicillin or penicillin? Does that make sense? Do y'all follow me?
Yes, doctor.
Okay. So which of these would be a contraindication for me to give this patient a penicillin or amoxicillin? Well, let's go through them. All right. A patient is 25-year-old, they're taking birth control pill. Is that contraindicated for a?
No.
Okay, right. Because they can take birth control pills. That's not going to affect whether they're taking a penicillin, right? So a 70-year-old man is on warfarin, right? And his iron Now, you may not know this, but an INR of 2.0, is that normal?
It's normal.
It's normal. So is that contraindicated?
No.
No.
Oh, so that's okay. So you have a 6-month-old pediatric patient, right? Is penicillin contraindicated in a pediatric patient?
Yes.
You
No.
sure? So if a PD patient, if they had a bacterial, if it's something bacterial, you would have to give them an antibiotic, right? Wouldn't you? If you had to,
We
well,
can't
let me
give.
let me ask you a different question. If a pediatric patient had a bacterial infection, would you do nothing?
They need antibiotic.
Right. So you know you got to give them an antibiotic, right?
Yeah.
So the question is a penicillin contraindicated?
No,
'Cause
doctor.
what other antibiotic would you give them that would not be contraindicated? You follow me? Everybody with me so far?
Yes, doctor.
Now,
Yeah.
keep in
Yes,
mind,
doctor.
we're not talking about an embryo. We're talking about a pediatric patient. All right. So just by elimination choice, we've eliminated 3 and we're left with 1, right?
Mhm.
It's got to be D. Does that make sense? But the question is, why is the answer D? Why is it D? can tell
Treatment
me.
for
Anybody?
syphilis. Syphilis is a viral.
Yes. Well, no, syphilis is bacterial.
As bacterial. Sorry.
How do you treat syphilis? Intramuscular penicillin, right? So let's look at this patient. You got an 18-year-old. They had syphilis. They were treated for syphilis with penicillin. And when they were treated, guess what happened? They got Stevens-Johnson syndrome. So what does that tell you about this patient when they took penicillin? They have what? An allergic reaction, right? Do you understand this?
Yes. And amoxicillin
Okay.
is contraindication for allergic reaction.
Right, because they were allergic to penicillin before. Because they were allergic before, then that means you can't give them amoxicillin because they've already shown you they're allergic to penicillin. Does that make sense to everyone?
Would you mind repeating that for me, please? That I didn't understand
Yes.
that.
Okay. No problem. Okay. So we agree that amoxicillin is penicillin, correct?
Mm-hmm. Yeah.
Okay. And so this patient, he's 18 years old, and they said that in the past he was treated for syphilis, right?
Mm-hmm.
And when he was treated for syphilis, he developed this Stevens-Johnson syndrome, which
Okay.
you may not know what the syndrome is, but you know that something happened when he took the penicillin because he was treated for
Okay.
syphilis, and you treat syphilis with penicillin.
Mm-hmm.
Okay. So since he had that reaction to penicillin 4, then you don't want to give him penicillin again. Does that make sense?
Yes.
Right. So that's why the amoxicillin would be contraindicated in this patient. Okay.
Okay.
All right. Perfect. All right. Now, okay. So let's think about this right now. The big picture. Here's the big picture. Whenever you're treating a bacterial infection, you got to target the bacteria to what makes the bacteria live. Does that make sense? So, for instance, if someone lived because of their arms, and you didn't want them to live, you would take off the arms. Does that make sense?
Yes, doctor.
So, with a bacteria, you have to target the part of the bacteria that's sensitive to the antibiotic. So, let me show you what I'm talking about. So, all the bacteria that we're going to be talking about have a cell wall, right? So, when you target, the one way the antibiotic can work is it can actually target the cell wall. It can inhibit the cell wall from actually being built. Does that make sense? Okay, perfect. The second thing you can do is you can actually block that peptidoglycan synthesis, right? You can block it. So the wall has already been made, right? Or you can kind of interfere with the synthesis. We'll tell you how those differ. The other thing is you can inhibit folic acid synthesis. I'll tell you that. Now, these two right here, 50S and 30S. Now, bacteria, these are the ribosomal subunits for bacteria. Do you all know what the ribosomal is for us, like a eukaryote? Do you know our units? We are 60 and 40, all right? So human ribosomes, right? The human ribosomes are 60-40. We're bigger, the ribosomes are bigger. The bacteria, they're 50-30. Do you see now how an antibiotic can target the 50-30 and not hurt us?
Yes,
Does
doctor.
everybody understand that? Okay, perfect. Okay, good. Now, the first thing I told you is that one way you can target bacteria is by the cell wall, right? Bacteria has a cell wall. Let's go target the cell wall. Let's go and hit the cell wall. So this mnemonic is a little hard to remember, but I'll tell you what's important. So it says my sister, cysteine is an amino acid, valine is another amino acid, had a nice ring, all right, nice ring from her fiance Vic when he got back home from Arizona. Her house has ceilings and no walls. Let me tell you what this means. I'm gonna make it real simple. Okay. This right here tells you the bacteria, the antibiotics that inhibit the cell wall. So watch this. You see right here where it says Vic, VICC, that's vancomycin, imipenem, cephalosporins, and cycloserine. The Vic, those are the antibiotics that can inhibit the cell wall. The back, right here back, is bacitracin. Arizona is aztreonam. The center is the penicillins. All right. Now, the ones they ask you most about on the exam are the cephalosporins, vancomycin, and penicillin. Everybody follow me? So, if I were to ask you what's the mechanism of action for vancomycin, what would you tell me?
Inhibit the cell wall.
Good. It inhibits the cell wall. Inhibits the cell wall. Okay. What's the mechanism of action for cephalosporins?
Inhibits the cell wall.
What's the mechanism of action for penicillins?
Inhibit the cell walls.
Isn't it easy? That's pretty easy, right?
Yes.
Now,
Yes, doctor.
the penicillin, whenever you look at the penicillin, it looks like this. We call this the beta lactam ring. So the penicillin looks just like this. It's a beta lactam ring. Okay. And so some bacteria have gotten pretty smart. And so some bacteria will produce something called beta lactamase. And guess what beta lactamase does? It goes and it blocks the beta lactam ring of the penicillin. So if a bacteria produces beta lactamase, will that make the penicillin work better or worse?
Worse.
Exactly. That's right. So yes. So if somebody's taking amoxicillin, right, and they have a bacteria that has beta lactamase, then you don't want that. So you may have to add lactamase inhibitor. Does that make sense? And so,
Yes.
so an example of beta lactamase inhibitor is something called clavulanic. You probably heard about this. So, like, you can mix clavulanic acid and amoxicillin, and if you mix those two together, you get something called augmentin. You all follow me?
Yes, doctor.
Yeah.
So what is clavulanic acid? What is clavulanic acid?
Beta lactamase inhibitor.
Good. What's the purpose of clavulanic acid?
To inhibit beta lactic ring.
Wait, no. You're on the right track when you first started. So what's the inhibited? What's the purpose of the beta lactamase inhibitor?
Inhibits beta lactic acid.
Beta lactamase.
Beta lactamase.
So it's the lactamase, right? Now, why do you want to inhibit the beta lactamase? What's the reason? Why do we want to inhibit the beta lactamase? Because
the bacteria
so what does beta
has
lactamase do? Yeah, keep going. I'm listening.
because bacteria has the beta lactam ring.
Not the bacteria. You remember the beta lactam ring is the penicillin. All right, you follow me? So the beta lactam ring is the ring for penicillin.
Okay.
Now you were right about the other thing. Who produces the beta lactamase?
The bacteria.
Correct. So if the bacteria produces the beta lactamase, then what is the beta lactamase gonna do?
Block penicillin.
Correct. Perfect. So what is the purpose of the beta lactamase inhibitor?
To inhibit the beta lactamase from the bacteria to connect to the penicillin.
So that way the penicillin can work.
Can work. Yes.
There you go. Perfect. Does that make sense to everyone?
Yes.
Yes, doctor.
All right, good. Perfect. Good job. All right. All right.
It was a
So
bit
we just
hard.
talked about the penicillin. So we have an oral and the intramuscular and IV. So the oral, which one is the oral penicillin?
Amoxicillin.
Amoxicillin.
Well, I'm sorry. I should have been more specific. Pen V or Pen G? It's oral.
NV is oral.
Good.
Pen
And
V.
Pen G is what? It's intramuscular or what?
Intravenous.
Right. Now, why is Pen V better orally? Why don't we give PNG orally?
Because of the acidity in our stomach, which can actually break down and absorb the antibiotic correctly through the intestines.
Very good. Perfect. That's exactly right. Perfect. And so we know that we can give PNG intramuscular syphilis. Remember that 18-year-old boy we just looked at?
Yes.
That's right. So that's an example like benzoate, right? We can give that intramuscularly to treat syphilis. All right. Now, look at this right here. So you see these wide spectrum antibiotics, right? Wide spectrum penicillins. Wide spectrum means they just can cover several different things. But I want you to notice how the mnemonic that I'm using, okay? I say wide means that they're amped up. You see this AM on acid, right? Amped up on acid. Let me explain what this means, okay? So ampicillin and amoxicillin, that's your AM. See that AM? That's your wide spectrum. Think AM, ampicillin, amoxicillin, all right? Now, if you look at the amoxicillin, right, the amoxicillin, you see how I have MO highlighted? Y'all see that? The MO, I want you to think of methotrexate, okay? Methotrexate. Anybody know what methotrexate is used for? Have you ever
Not
heard of
quite sure.
methotrexate? Okay. So basically methotrexate is one of those things that you can use for, you probably heard like people who have like rheumatoid arthritis or something like that.
Yes.
So that's one of those things that, yeah, so you probably heard of like for certain autoimmune conditions like rheumatoid arthritis, but methotrexate is also used as a chemotherapy. So if somebody had like some type of gastrointestinal cancer, a lymphoma, osteosarcomas, methotrexate is what we call either an anti-neoplastic drug, meaning that you can use it as a chemotherapy, or it can be used as an autoimmune drug for like rheumatoid arthritis or psoriasis. Okay, I got that?
Yes, doctor.
So, but look what I put. Amoxicillin in methotrexate, keeping it in the tissue, causing oral ulcers. So here's my question. Is amoxicillin contraindicated with methotrexate?
Yes.
It is, exactly. And we know why, don't we?
It causes oral ulcers.
Right. So we don't want that to happen. So we would want to use a different type of antibiotic. Does that make sense?
Yes,
Now,
doctor.
you see this MO? This MO also means, see, MO, otitis media. So amoxicillin, one of the side effects is that it can cause this ear infection. Okay, that makes sense? Okay, great. So here's the takeaway from this slide. Whenever you're thinking about this ampicillin, amoxicillin, remember the AM. Remember the O. Those are things that will help you remember the side effects of amoxicillin, and it'll also help you remember those are wide spectrums, okay? Now down here, these are things that are amoxicillin and ampicillin are good for, okay? You can look at this on your own to kind of look at the mnemonic. I'm not going to go through that now, but there are several different things you can use ampicillin and amoxicillin for, okay? Now, you remember we talked earlier about clavulanic acid? And we said
Yes, doctor.
clavulanic acid is a beta-lactamase inhibitor. We can when we combine the clavulanic acid and amoxicillin, what do we call that? What's the name of that?
Beta lacto.
Augmentin.
Well,
Augment.
augmentin, yes. So whenever you combine the amoxicillin with the clavulanic acid, that combination together is called augmentin. You may see that on the exam, okay? All right. Now, let's look at this one. So we looked at this wide spectrum, right? Narrow spectrum. What do you think a narrow spectrum antibiotic is going to do?
It's for a specific infection.
Right. So it's going to be more specific, more targeted. And so this right here is a mnemonic. It says Don. Skinny means narrow. Okay, skinny meaning narrow. Don is narrow. He's skinny. And he's not scared to get in the ring. What ring are we talking about?
The
beta
cellular wall.
lactam ring. You follow me? Well, the beta lactam ring of penicillin. So what this means, this mnemonic, I want you to imagine this. Imagine Don is a person. He's skinny. He's not a big guy. He's skinny. But he's not scared to get in the ring. So since he's not afraid to get in the ring, he's not afraid of beta lactamase. Do y'all follow me? So
yes,
if he's not afraid of beta lactamase, then you don't need a beta lactamase inhibitor. Does that make sense? So let me say it again, because I'm not hearing yeses. So let me say it again. Let me put it this way. So you remember when we looked at amoxicillin, we said that if a bacteria produced a beta lactamase, then we would have to combine amoxicillin with something else, an inhibitor. Does that make sense?
Yeah.
yes, doctor.
Okay. Now we're talking about Don, D-O-N. Don doesn't need a beta lactamase inhibitor. You know why? Because Don already has that ability. Don is not afraid to get in the ring because Don already has beta lactamase inhibitor properties. It doesn't need to combine with anything. Because even though Don is skinny, he's not scared of beta lactamase. Do you follow me?
Yes.
Yes, doctor.
So, who is Don? I know that's the question you were asking.
Augmentin.
Dicloxacillin, oxacillin, and nafcillin. That's Don. Do y'all see that? So these antibiotics do not need to be combined with a beta lactamase inhibitor. Does that make sense?
Yes, doctor.
Okay. And nafcillin is good for staph. Okay. So NAF is good for staph. So that's one of the ones that if you wanted to think about one of those ones. Okay. All right. We just have a few more. All right. Before we go to the next thing. So IV penicillins. Well, we know Pen G is IV, right?
Yes.
The other one is, watch this. I'm going to get, that's my Pen G. In my car, that's carbenicillin. And I'm going to get in my car and I'm going to meet IV, because these are IV penicillins. So IV penicillins are going to be your Pen G, carbenicillin, and methicillin. Everybody can understand that?
Yes, doctor.
All right, perfect. Now, oral penicillins, right? Now, I could just say, you know what? If it's not IV, it's oral. I could just say that, right? That would be an easier way to do it, wouldn't it? Because cloxacillin, oxacillin, dicloxacillin, Pen-V, we know amoxicillin. Ampicillin could be IV or IM, but ampicillin can also be given by mouth. So that's why it's in this group. And then nafcillin. So if you know your IV penicillins, then you should know which ones are not IV. Does that make sense?
Yes, doctor.
Okay, perfect. All right. So I'm going to stop that for there, going into prophylactic treatment. We'll do that the next time we meet. So as I always ask, one of the things I like to ask is, one, what we covered tonight, can you teach this to someone? Because that's the only way I can understand it. Can you teach what you learned?
It's possible, but I'll have to revise it again a couple of times.
No,
Same with me.
no, not a couple of times. No, that is not. Nope. See, once we go through it one time, it should be okay. Let me prove it to you. I'm going to prove it to you. Don't look at your notes. I'm going to just ask some questions. Okay. What's the mechanism of action for amoxicillin?
Amoxicillin inhibits the cellular wall.
Perfect.
Cell wall inhibitor.
Cell wall inhibitor. Very good. What is the okay? What is the contraindication to amoxicillin? Name 2 contraindications to amoxicillin.
Who's allergic to penicillin?
Good, very good. Allergic to penicillin. What else?
Combined with
You got it.
meth.
Yep. Say it. Say it. That's right. Methotrexate. You were going to say it. Methotrexate.
I don't
Exactly.
actually remember the name. It's MO.
MO. There you go. You remember that, right? So which antibiotics are narrow spectrum? So
Amoxicillin.
wait, let's think about it. Which antibiotics are narrow spectrum? Narrow spectrum. Narrow spectrum. Don't look at your notes. Look at I can see you looking down.
Doxycycline.
Yes. Good. Oh, Dr. Olga is right. I see you, Dr. Olga. She said Dr. Olga put up in the chat, she put the mnemonic, which is what? Who is not afraid to get in the ring?
Dawn.
So
Dawn, yeah.
that's right.
Oxycycline.
That's right, Dr. Olga. Oxycillin, doxycycillin, and then the last one was what?
Nafcillin.
Nafcillin. Perfect.
Nafcillin.
So you remember that Dawn is skinny. That's right. Dawn is skinny, not afraid to get in the ring. Very good. When you combine amoxicillin with clavulanic acid, what do you get?
Augmentin.
Augmentin.
Very good. What is the dose for amoxicillin?
500 milligrams.
500 milligrams.
How many times a day?
Twice.
3 times a day.
Well, typically it's 3 times a day. So you typically give it every 8 hours.
Mm-hmm.
Yeah, so for amoxicillin. Okay, very good. All right, hold on. I'm not done. Is streptococcus catalase positive or catalase negative?
Catalase negative.
Positive.
Very good, Dr. Joseph.
Negative.
Catalase negative. What is the purpose of catalase?
Blocks down H2O2.
Not blocks it.
Breaks down.
Breaks down hydrogen peroxide. Very good. Perfect. Very good. Next question. what two antibiotics work at the 30S ribosomal subunit? The 30S.
Tetracycline.
Tetracycline, very good. And what's the other? The aminoglycoside. Aminoglycoside. Very good. What do we use methotrexate for?
We use it for radiation treatment,
chemotherapy, and what else?
And osteoarthritis,
rheumatoid arthritis,
rheumatoid,
because it's an autoimmune condition. All right, so that was just a little thing. Now you actually know a lot. You all know a lot, so I don't think you need to revise it 3 times. Maybe once.
The details.
Okay, just the details. Okay, perfect. So hopefully this, everybody followed. And so what we're going to do when we meet on next time, let me look at the calendar. So it looks like we have, so it looks like we have bisphosphonates for the 8th. What we're going to do is we're going to finish up the antibiotics because we didn't finish that tonight. So we're going to finish up the antibiotics, that PowerPoint on Wednesday. And we're going to move bisphosphonates. I'm going to move that in the calendar. So just go ahead and finish the antibiotics PowerPoint that you all have. Because in that PowerPoint, you'll have antibiotics, I think antifungals and antivirals. So just get through as much as you can by Wednesday. Okay?
Okay.
All right. Any questions? All right. Okay.
Understood everything.
All right. Perfect. All right. Well, we will see you all on Wednesday.
Thank you, doctor.
All right. Have a great night.
Have a lovely night.
Okay.
All right. Bye-bye.